Hello and welcome to the Eyecare podcast brought to you by Visiclix Digital Marketing Agency. I'm your host, Mark Bianchi, and with me on the podcast today is Dr. Damon Dierker, an optometrist, the director of optometric services at Eye Surgeons of Indiana, also the co-founder and program chair of Eyes on Dry Eye. So without further ado, Dr. Dierker, thank you for joining us.
Hey, Mark, thanks for having me.
You're welcome. So one of the reasons I wanted to have you on was because you specialize in an area of optometry that seems to have really come on really strong in the last several years, which is dry eye. So just curious, how was dry eye something that you were really interested in getting involved in, and what got you started in that process?
Yeah, really interesting journey for me. I joined my practice in 2002 out of Indiana University School of Optometry, and I actually did a retina fellowship. So at that time in retina, this was before we had OCT. This is before we were doing injections for macular degeneration, diabetes. So it was a much different world. So the first couple of years, all I did was retina, and dry eye and ocular surface was as far away from an area of interest as I could imagine at that point. You know, the cornea and ocular surface was a window to the retina. But then as I started to see more and more patients and kind of build out my clinic with glaucoma and perioperative cares, there was just this huge need for patients that had dry eye and MGD, blepharitis, because a lot of people were really ignoring it. We didn't have great tools when I was starting to get interested in it. But then over the last decade, 10, 15 years, really, there's been just a lot of innovation in the space, a lot of things that we can do from the diagnostic side, from the therapeutic side. And I looked around the Indianapolis community at optometry, ophthalmology, cornea specialists, and nobody gave a hoot about this stuff. You know, it was totally wide open, and we have all these patients coming in that are suffering. So I took it upon myself to really get good at this, and a lot of self-study, a lot of working with colleagues through personal conversation. And then that led to a dedicated dry eye clinic within my practice starting about 10 years ago. And now that's built into about 2/3 of my clinic time is spent in a referral dry eye, where patients are coming in for fourth and fifth opinions about things. In more complex situations, you know, 2 or 3 hour radius, people are coming in to see our clinic. And other times, just people, you know, hey, I saw you on this podcast, or I saw you online and wanted to know what my options were because I tried this, it didn't work that well. So for me, it's really been a passion that was developed out of need in our community and in our practice. And then I've just kind of taken the ball and run with it.
So when you have a patient come in and they talk about those options and they say, I've tried this, I've tried that, what types of things have people tried in the past that maybe they didn't have a lot of success with, where with new technology and new ways of doing things today, maybe they have better success?
A lot of times people will come in with dry eye diagnosis, and we look at them and it's maybe not exactly dry eye. Maybe it's a masquerader, that they've got some other issue that's the primary issue. But if we determine that they do in fact have dry eye as the primary reason for their complaint, you know, most people have gone through some over-the-counter lubricant drops. Studies show that people usually have tried several drops before they even see an eye care provider. And maybe they've been on a prescription medication, but they were only on it for a month because they thought that it should cure things by that point, or maybe they had some burning and stinging with some earlier generation medications and had tolerability issues, or maybe just not aligned as to what the medication was actually supposed to do for them. So then they get frustrated, they try to self-treat, they talk to their friends, they ask Dr. Google what's going on, and then, you know, hopefully get to a doctor that is willing to diagnose them and treat them. And I've been very much front and center in any patient coming in my practice, whether it's primary complaint of cataract, or maybe somebody saw something in their retina, they're suspicious for glaucoma. It's still the second most common reason someone will see an optometrist is for ocular surface disease. The most common still is refractive error. You know, they need some help with their nearsightedness, farsightedness, astigmatism. But the most common medical reason is ocular surface. So I screen everybody I understand, first off, what we're trying to accomplish. Like, what are they hoping to do? Whether it's to be able to wear their contacts more successfully, or they're getting ready for LASIK surgery or cataract surgery, or maybe they want to be able to look at their phone at the end of the day without wanting to rip their eyes out, right? And then say, okay, this is what we're hoping to accomplish. Then do appropriate diagnostic tests, come up with a diagnosis, or sometimes very commonly multiple diagnoses, and then come up with a plan with all of the tools that we have at our disposal. And even occasionally it's like, hey, we're going to do this now, but there's this cool thing coming in about 6 months. I think you're going to be a great candidate for. I'm going to put you into my phone on that list so that we can contact you. So I think it's establishing a relationship with the patient, getting aligned on goals, letting them know that you are there to help them and that you're not going to give up on them. And if something doesn't work exactly how we would hope the first go around, we've got other things that we can do. But the more you do that and the more you see the impact that you have on these patients' lives, the more rewarding it continues to be. And then with technology, there's just all sorts of cool stuff that's happening that say, hey, let me figure out how to incorporate this. It's just been a lot of fun. So there's so much happening in the space. And what I do in 2025 is light years different than what I did in 2023. And I can't even think about what I was doing in 2015. It's just, so what am I going to be doing in 2030 or 2035? It's going to be crazy.
Right. I understand it probably varies from patient to patient, but are there certain procedures that you find work better than others when it comes to dry eye syndrome?
So there's a lot of patients that the reason they have dry eye is because they have inflammatory lid disease. They have rosacea, they have blepharitis, they have meibomian gland dysfunction. And a lot of the treatments that are out there that are prescription therapies don't always directly target that. They will help with symptoms, they'll help with inflammation, they'll help with tear film stability. But some of these patients need work on their eyelids and their dermatologic condition to really attack their problems. So we use a lot of light-based therapy, intense pulse light, a low-level light therapy, things that are done in the office as part of our core for many patients, and then complement that with prescription medication, over-the-counter therapies. And then in cases that are more advanced or recalcitrant, then there's other biologics or other tools that we can use. But most commonly, and really the heart of our practice is patients with meibomian gland dysfunction as the cause of their dry eye, and then addressing their inflammation of their eyelid and the obstruction of their glands through light as well as through thermal treatments, heat therapy to get rid of the blockages in their oil glands.
Sure. So I did a little research on you before the podcast here, and I saw that you were a music major in college. How does one get from being a music major to being an optometrist?
Yeah, that's a really good question is, how does one become a music major if you're going to go into optometry? So I from Minnesota, I wanted to be a biology major. And I said, well, I kind of really want to try out for piano, right? I've played a little bit and maybe I can learn how to play piano better in college. Well, I did not pass the initial tryout to get into the piano program. It just wasn't classically trained, right? So I said, well, that's a bummer. I played a little guitar. How about guitar? I see that they're offering some guitar courses, and that turned into, at certain points in my college career, playing for 4 or 5 hours a day, classical guitar, playing with chamber orchestras and duet partners, and just a lot of fun endeavors that it was just a really fun hobby and continues to be a fun hobby. So when I was looking at and kind of landed as I was pretty sure I wasn't going to go into music as a career, and I was into the sciences and had ultimately landed on optometry. I said, well, where can I go? Because Minnesota doesn't have an optometry school. So it turns out at that time, Indiana University in Bloomington had a top 3 optometry school and a top 3 music school. So that's why I chose to become a Hoosier, was because of their music school in Bloomington. And I studied classical guitar for 3 years through one of the top graduate students at IU as my hobby as I was, going through optometry school.
And do you have a guitar in office? Do you play for the staff or the patients?
I've played occasionally at office parties. Nowadays, it's hard as an optometrist, and Mark, I know you're a musician and guitarist, and it's not the easiest thing to keep up your classical guitar nails in the world of optometry. So I've had to kind of trim those down a bit. So I actually play more piano now than anything. And my wife is the singer in the family, so we do things for friends and family. We do some weddings and funerals and all sorts of things. But
Really?
the most memorable recently is my sister got married on the beach in Florida. I did all of the music on guitar, heavy on Beatles, and my wife did all of the singing, and it was just a really memorable experience for everybody.
Really cool. So you were a music major, but decided on optometry. Why optometry versus any other field?
So to be fair, I was biology and music, which in 4 years at a small liberal arts school meant I did a summer of physics in 6 weeks, or a year of physics in a summer about 6 weeks. So it was a little bit tough to get both of those, but I had to, always looked at medical. Optometry seemed like a good fit after I kind of explored other options. And then I just have a family history of some pretty significant eye issues. And my father had a systemic condition at a young age, and he developed cataracts that needed to be removed when he was in his 30s. So this would have been, 50, 60 years ago, and this is before we used intraocular lens implants routinely. So that meant that he was aphakic, meaning he doesn't have any sort of lens in his eye. So he had to use a combination of hard contact lenses and glasses to be able to function. And he was, without either his Coke bottle glasses or a combination of glasses and contacts, he was not able to, do anything. So to see how optometry and ophthalmology really helped him to be able to function after having this significant life event that cost him his vision. Well, his vision returned with what we could do as optometrists. So that was one of the things I looked at. Is like, wow, I really have a lot of respect for the doctors that helped him to see.
Well, yeah, obviously a very personal experience there with optometry then, and how it could really affect someone in the family. And I would imagine that carries over to the patients you work with today. You know that what they're going through, and you see what they're going through, and you have the empathy to understand what they're going through. That's a very important part of what you do, I'm sure.
And I think a lot of patients now, there's just a lot going on, right? And we went through the pandemic times, and now lots of things going on. And a lot of patients, their eye issue is one of many health issues. So we got to really look at the patient as a whole and not just as a set of eyeballs, because we can treat eyeballs, but treating patients is what really takes the talent and the skill is to develop that rapport and help them to do whatever they need to make their lives better through what we can do as optometrists.
So, what got you then into the CE program that you host? And I believe it started a while ago with the dry eye boot camp.
Yeah, so looking back at the genesis of that, which was about 10 years ago now, kind of went over my frustration a little bit. Is like I couldn't find anywhere when I was trying to become an expert in ocular surface. There wasn't anywhere to go to get that training. And I had to do a lot of this myself. And I looked at everything I did to get up to just a adequate level in this space for what the technology we had in 2015 was. I said, this is crazy. I don't think optometrists or ophthalmologists are going to have the time or energy to be able to do what I was doing to get up to speed. So I said, well, let me see what I can do and what I've learned and bring it into a CE program, but do it differently than what we would normally go to. So I created this concept in my practice called Dry Eye Boot Camp, which a day-long event, kind of a hands-on, very interactive event. But then to spice it up, I mean, literally as a boot camp, we dressed up in army fatigues. I had bullhorns and a lot of bad military puns. but it was all about getting people excited because dry eye at that time was not exciting. It was what everybody was running away from. So we kind of made a splash and then said, wow, this went great. Let's do it again. And then we made a bigger splash. And then I said, well, okay, what's next? And at that point, it was, well, these are both in Indiana. And I really had no intention of ever doing anything on a larger scale. But then a lot of friends and industry folks came to me and said, Damon, you got to take this show on the road. And I said, let me think about it. But then ultimately got some of my friends together and we did several national programs in all parts of the country. We're bringing the boot camp theme, and it was just a lot of fun. A lot of it, probably 500 or 600 people attended those events. I still see people at conferences or online today where they say, "Hey, I went to your boot camp in 2017, and I started my dry eye spa, and it's just now we're getting ready to open a second location." So I mean, it's just a lot of things that I look at that. I'm very proud of how all of that started, but it really was to fill a need in the market where I didn't feel like there were programs that were engaging or fun to help get information to people to get them excited about this disease state. And then pandemic hit. I said, oh, okay, well, that was fun while it lasted. No one's going anywhere. So I got together with my buddy Ahmad Fahmy out in Minnesota, who was just starting a live program for more kind of intermediate to advanced care, and mine was definitely more beginner to intermediate. I said, why don't we, combine forces and do something virtually? And we went all in on it, and I think we pulled off probably the most successful program of any kind in optometry ophthalmology from a virtual education standpoint. We had a couple thousand attendees virtually in 2020 for our first Eyes On event, and now that's just blossomed where routinely when we do our big annual event, now it's either 2 or 3 days depending on a couple factors there, timing, etc. But we have people from all over the world that come to the event, and some folks. There's a gentleman in Australia that has never missed an Eyes On Eyecare dry eye event, and so he's up there at 4 in the morning listening and just doing stuff that are impacting people all over the place is like, kind of gets addicting a little bit, right? There's so much that we can do to help doctors help patients.
Do you do anything else with the Eyes On Eye Care group?
So there's several things that they do in the digital space. They also do a lot in doctor recruiting. It's number one site to be able to go and find a new associate for your practice. Everything that I'm doing is really education, mostly continuing education, some promotional things, mostly dry eye, but some glaucoma and retina as well. And then the last 2 years, I've done a monthly program called Eyes On Eye Care Dry Eye Fireside Chat, where I just have a conversation and have a topic and then get an expert to kind of glean some insights as to, what are they doing in their practice? How are you using new technology? How do you communicate with the patient? How do you bill and code? I mean, all sorts of different things. And then have this nice library now of content that people can access that is not CE. It's just real talk, real world advice. And that's been a lot of fun in addition to all the things that we do that are continuing education as well.
You sound pretty busy.
Yeah, wife and kids, I still try to do my best to have a work-life balance. In my practice, I typically see patients 3 to 4 days a week, and I have some time for admin, for business development, and for outside endeavors. But they're definitely passion projects, and it's something that, I was a musician, you have to perform. There's definitely an element of performance to some of the things that I do. But at the same time, looking back in high school, college is like the worst day of my week would be if I had to go up and stand in front of a crowd for 5 minutes and give a speech. So I would have never thought that the things that I've said yes to or the things that I've developed would ever be part of what I was doing. And I think optometry has opened all of those doors for me. And I've just tried to keep as many doors open as possible. And some of them I run through, some of them I kind of tiptoe through. But I think it's always a lot of fun.
So you went from being a shy kid to being a performer on stage with guitar and piano, then performing for the entire world with the Eyes on Dry Eye, it sounds like.
It's pretty cool, huh?
Yeah, yeah. You've come a long way. Well, if someone was interested in knowing more about what you do and how maybe you can help some other optometrists out there, particularly if they want to start a dry eye clinic or would it be a dry eye clinic? Is that what you call it?
Yeah, try. I mean, I think that it's not even has to be a dry eye clinic because hey, I want to do more for my dry eye patients, and that
Okay.
can be in any sort of practice setting, whether it's a comprehensive practice or a contact lens heavy practice. Certainly, a lot of people are building standalone dry eye clinics or dry eye spas, but you don't have to do that. I think looking at a lot of the content that's on Eyes on Eye Care, coming to Eyes on Dry Eye, reaching out to me directly. Happy to do that through social media because there's a lot of folks that say, "Hey, I'm thinking about, buying this technology. I wanted to know what your thoughts were," or here is what I was thinking in terms of a treatment protocol or diagnostic workup. Happy to have some conversations for anybody that's interested because it's great to be able to give because I learned so much from so many people. And if people are doing things that are going to have a huge impact, not only on patient care, but on their health of their practice, I'm all in on it.
That's great. Thank you. So they can find you on LinkedIn, I would imagine.
LinkedIn is probably the best way to get to me.
Okay, great. LinkedIn or visit the Eyes on Eye Care website. I would imagine there's a way to get in touch with you through that as well.
Absolutely.
And of course, Eye Surgeons of Indiana, which is where you're practicing right now in the Indianapolis area. So great. All right. Well, we'll make sure people reach out to you if they need any assistance or help or would like to get more information about what you do. And I really appreciate you being on the podcast. It was very informative. So thank you very much.
Happy to do it, Mark. Take care.
Thanks. You too.